It is interesting to sort of try and take the culture apart and try and understand why harassment and bullying finds a toehold in medicine.
As a woman in medicine, how do you think that shaped what it is for you to be a doctor today?
So you have an industry that is very male-dominated, it's very hierarchical, and it's now populated with a lot of women, and yet you see pay gaps, inequity gaps, leadership gaps, as well as sexual harassment. And so I think that the time is now to try and change our industry as much as we can to make it a safe, dignified, and equitable work environment for our colleagues. I know my daughter is one of the main reasons that I do the work that I do. I have been her Girl Scout troop leader since she was in kindergarten. I found it very disingenuous to sell these girls on careers in STEM when we knew what they would be encountering once they got into the workforce.
We still see stories on a regular basis about hazing in healthcare, bullying, violence, harassment. What about the culture of medicine allows for these kind of instances to persist?
What I have found is that there is a sense of hierarchy, right? With the surgeon being at the top, because the surgeon can make a mistake, the surgeon can fail to see something, and thank goodness if others in the operating room feel safe to say so. But I think that when you come to a stressful environment like the operating room or the emergency room, you sometimes rely on maybe a little bit more base instincts. And so if culturally you have some misogynistic tendencies, those can come out. They can harm patients and hurt the staff.
You talked about the need to tie compensation of hospital and academic leadership to gender equity metrics. Why do you see this as the solution?
I think it would be really good if healthcare would treat sexual harassment and gender discrimination like we treat an abscess in medicine. It needs to be lanced and it needs to be drained. But here's what I imagine. If you are able to be honest about what is in that abscess, the number of sexual harassment claims that were filed in your institution, the number of gender discrimination claims that were filed, the number of these claims that are investigated, and then the outcome of those investigations, in addition to metrics. From there, what you do is you hire good people who are going to help you move the needle on that culture.
So do you think hospital leaders want to do this? Is this going to take board intervention to get changes like this?
As a culture, as a society, we haven't valued the role of women and how women feel in the work environment enough to sort of make these changes and to be honest with ourselves. But I think, luckily, we are at a tipping point, and hopefully we are going to see some of these brave and courageous leaders coming forward. Yeah, that's my hope.